Hello, I'm Noma Anderson. This course is titled Combating Microaggressions. How can I help? Here are my speaker disclosures. Financial, Dean of the College of Nursing and Health Sciences at the University of Vermont, and compensation from ASHA for this course. My non-financial disclosures are I'm an affiliate of ASHA CEUs 14 and a member of NBASLA. This micro course was developed as part of a series on microaggressions. Each course takes on a different aspect of the issue. This micro course focuses on the ally. Conventionally, an ally belongs to the dominant social groups, for example, white, male, heterosexual, and is supportive of non-dominant social groups, for example, BIPOC individuals, women, LGBTQ individuals. Allies are attuned to socio-political dynamics of race and racism, even more than bystanders are. Allies actively combat and eradicate the injustices they witness. Are the dominant social groups in our professions of audiology and speech-language pathology different in terms of gender? In many cases, yes, but here is an interesting cumulative exception. Consider that while a very small percentage of ASHA members are male, 62% of ASHA honors recipients between 1940 and 2015 were men. Allies combat discrimination and social injustices. While bystanders work at the interpersonal level, allies work at the interpersonal and institutional level. Thus, allies work to combat institutional and systematic racism. Several scholars refer to institutional discrimination as macroaggressions. Often allies, who are individuals from dominant social groups, ask, "What can I do? What can be done?" Here are some examples of addressing systematic discrimination in our own professional context. This scenario of institutional and systemic discrimination occurs in many schools. Over the past few years, African American parents in the school I work in have expressed concerns about the large number of disciplinary actions, dismissals, and dress code infractions being directed toward BIPOC students. Allies and BIPOC students and parents can work together to create culturally responsive schools. This scenario presents the implicit bias that can occur at universities in the promotion and tenure processes. I was asked to submit the results of my research to a national journal on diversity, equity, and inclusion. When discussing it with my tenure mentor, he cautioned that the journal wouldn't be regarded as top tier by the University Promotion and Tenure Committee. Senior faculty can act as allies by intervening as diversity, equity, and inclusion champions to eliminate subjective bias in the promotion and tenure process. BIPOC individuals face obstacles to assessing my services. To name just a few, unique challenges assessing primary care, disparities in insurance coverage, lack of support in navigating the complexities of healthcare systems. Allies focused on advocacy initiatives with health insurance providers and state and federal governments are needed in this example. Their success would eliminate health disparities among BIPOC as well as LGBTQ communities. Here are some helpful resources. We've explored the concept. In the next activity, we'll review some examples.